Hi everyone, my name is Brandy Stevens and I'm a PhD candidate under the mentorship of Dr. Paul Fidel. The poster that I'm presenting today is titled The Influence of Family History of Hypertension on Spontaneous Cardiac Baroreflex Sensitivity in Young Non-Hispanic Black and White Men. It is well known that the prevalence of hypertension is higher in Black adults compared to white adults, which is the #1 precursor of cardiovascular disease. It is theorized that impairments in cardiac baroreflex sensitivity, or CBRS, may contribute to these racial disparities. Previous work that have investigated the impact of race on CBRS did not consider the potential influence of family history of hypertension. This is important since CBRS has previously been shown to be reduced in young healthy adults with a positive family history. Therefore, we tested the hypothesis that CBRS would be lower in young Black and white men with a family history compared to those without a family history. Moving on to the methods, we studied 29 young Black men and 31 young white men for this study. Spontaneous CBRS was determined via the sequence method. Sequences were determined at any time during the 10-minute baseline if there were 3 or more consecutive increases in systolic blood pressure with consecutive increases in R to R interval. Down sequences were 3 or more consecutive decreases in blood pressure with consecutive decreases in R to R interval, as well as all sequences combined for overall CBRS. We also measured time domain heart rate variability, or HRV, using RMSSD, which is an estimate of short-term components of heart rate variability and is primarily mediated by the parasympathetic nerve. If you take a look at the picture, you can see ECG connected for resting heart rate as well as finger blood pressure. The subject laid supine for 10 minutes during a resting period, which we recorded both heart rate and blood pressure to obtain CBRS. Moving on to the results. On the top, we have our overall cardiac CBRS, and figure A depicts overall CBRS, and you can see that there was a significant racial effect with Black men having higher overall CBRS compared to white men. And figure B to the right, we have white men and Black men broken down by both race and family history. This showed that there was no significant interactive effect for race and family history for overall CBRS. Moving down, here we have the overall CBRS gains divided by up gains in figure A and down gains in figure B. The up gains on the left show no significant family history or interactive effect. This is the same result for figure B with the down gains. Moving down, here we have heart rate in figure A and blood pressure in figure B. This shows that both of these measures were comparable across race and family history in all groups, and that the racial differences in CBRS above were not influenced by group differences in heart rate or blood pressure. Right below in the table, we have subject characteristics and resting cardiovascular variables. This just shows that the subjects between the groups were well matched for comparison. Moving on to the last column. Here we have on the top heart rate variability measured by RMSSD. Figure A shows a significant racial difference with Black men having higher HRV compared to their white counterparts. In figure B below, here you have the groups broken down by race and family history, and there was no effect of influence of family history on heart rate variability. Therefore, in summary, overall cardiac BRS was greater in Black men compared to white men. There was no influence of family history on overall CBRS. Heart rate variability was higher in Black men compared to white men, and there was no influence of family history on HRV. Therefore, in conclusion, these data suggest that family history of hypertension does not influence CBRS or HRV in young, healthy Black and white men. Therefore, young Black men have greater overall CBRS compared to white men, an effect that seems to be independent of family history of hypertension status. So this concludes my presentation. Please feel free to ask any questions. Thank you.